effects. I'm a professor at Florida International University in Miami, and I developed a throat infection that led to my current spasmodic dysphonia in late August of last year, which would be 2006. At the time, I was teaching 2 summer classes, which was double my normal teaching load, and I was being very authoritative and talking in a very deep voice, and I think I was doing that more because of my spasmodic torticollis, lingering effects from an earlier serious bout we've had, to the point where during the fall semester of teaching in 2006, it was very, very hoarse, and I kept lecturing and overcompensating. By mid-semester, it appeared to have improved, but then I could not maintain the rather unnatural voice that I had developed using. So by the end of the semester, it just collapsed. And right near my end of teaching, I only had 2 weeks left, I went into my class and I was whispering, and I couldn't get it above a whisper, and it just collapsed.
Of SD, and it is a holistic approach. It's the way that you look at your voice. You know, I don't think you really ever bought into the fact that you couldn't do something to get your voice back.
No.
You really had that piece of it. That was the biggest benefit that you had coming into this. Is that you said, no matter how bad this is right now, I know I can get my voice back. And that's what worked for you. You didn't believe this whole incurable thing, it's not going to be with you, and all of that. Earlier today, you and I were talking, though, about whether or not we talk about being cured. Now, I think if anybody looks at this tape or were to walk in the room, they would see 2 fairly normal voicing people having a conversation and not comment that there were voice disordered people in the room. You and I both, though, admitted that sometimes the voice feels a little bit off. Sometimes we may feel that effort creeping in a bit. But if we know what to do with it, if we know to let it go and put it to the side and not buy into it, that it really doesn't have to affect the way our voices sound.
Right. And I noticed just a couple of days ago, this was happening to me. It was curious because it was when I was trying to read really fast a dissertation that a student had submitted to me, and I was reading through 1 chapter. And when I talked to my aunt on the phone, who called me up when I was in the middle of this, I noticed that my voice sounded unusually tight. And I started to think, okay, I backed away a bit, slowed myself down, and it was okay, it was fine. But then I started to think about why it was tight at that moment. And then I realized I was racing. I was racing through what I was doing in ways in which I didn't enjoy what I was doing quite as much as I have been the last 2 or 3 months. And so then I realized when I went back to read the dissertation, I took my time. And just slowing everything down. Because with my neck, there was something to do with the optical nerve, because I was moving my eyes so rapidly from left to right. I read so much that I think that threw my neck off and gave me neurological problems. And there's a body of research that suggests the optical nerve may be an issue in terms of the neck problem.
Interesting.
So that connects to the fast-paced notion, the fact whenever you're doing anything, I mean, you should actually concentrate on slowing down as much as possible. That doesn't mean not having passion or not getting excited. It just means enjoying things more, letting things, when you can, just basically slow down as much as you can.
Right, absolutely. What did you think about the whole group setting, the group support of the clinic? Did you feel like that was an important piece of it for you, or not so much?
Yeah, I think so. I understood that people were coming at it from very different sort of conditions. Some people had it for shorter amounts of time. Some people had SD for longer periods of time. People's voices sounded very different. I always felt that my voice was the worst out of all the 6, And I think in some ways it was, because it was pretty extreme when it was bad. I mean,
it was pretty severe.
Pretty severe, yeah.
You were on the severe range,
I was
even more excited about, getting to the place that you are now, where you essentially have normal voicing. And, it's really exciting to see how far you came. But yeah, you're right.
Yeah. So, and some people were maybe I thought quite a bit better, a bit farther along. But I always was interested in how each individual was grappling with it. You know, so I try to keep in touch with people as much as possible. And I think